This video is about total shoulder arthroplasty and shoulder arthritis. Typically, when patients experience shoulder arthritis, the main complaint is pain and or stiffness within the shoulder. When a patient comes to my office complaining of shoulder pain and possibly arthritis, we'll first perform a thorough exam in which we closely examine the range of motion of the shoulder, as well as strengthen rotator cuff and different possible causes for the pain. Shoulder arthritis can be diagnosed on x-ray. So every patient will get an x-ray while in our office. On x-ray, what we will see in shoulder arthritis is that there is a loss of joint space between the head of the humerus or the ball and the glenoid or the socket of the shoulder. A lot of the times these two bones will be actually touching each other and there will be no space and the patient will have bone-on-bone arthritis. Initially, after the diagnosis of shoulder arthritis is made, we'll start with non-operative treatments. Non-operative treatments include physical therapy to help work on range of motion and strengthening, and also include the use of anti-inflammatories and or Tylenol. We can also perform a corticosteroid injection into the shoulder joint to help with the symptoms of arthritis. This injection is typically performed with the use of ultrasound imaging in the office to make sure we're getting into the shoulder joint. A lot of times an injection can provide really good relief for a patient and help with range of motion and really alleviate a lot of symptoms for quite a while. But at some point, when these injections and other non-operative modalities begin waning in effectiveness, that's when a patient will consider total shoulder arthroplasty. In general, there's two types of shoulder arthroplasty. There's what we call a anatomic total shoulder arthroplasty, and then there's what we call a reverse total shoulder arthroplasty. There's a lot of differences between the two, and there can be a long discussion about the intricacies involved in each different surgery. But in general, a anatomic total shoulder replacement is taking a shoulder which is in a ball and socket joint and replacing the ball with a metal ball, and it's replacing the socket with a plastic socket. All of the rotator cuff muscles remain intact. In a reverse total shoulder replacement, the socket is actually replaced with a small metal ball, and the ball or the head of the humerus is replaced with a socket type device that has a plastic piece in between, thus reversing the anatomy of the shoulder. The main advantage of a reverse shoulder replacement versus an anatomic total shoulder replacement is it does not require a robust rotator cuff or intact rotator cuff. By reversing the anatomy of the shoulder, it allows a patient to power the shoulder with other big muscles around the shoulder like a deltoid muscle, latissimus muscle, or even a pectoralis muscle, as opposed to using the rotator cuff musculature. This is a big advantage in a lot of patients, as a lot of patients with this, with shoulder arthritis also have very weak rotator cuffs or possibly torn rotator cuffs. So a reverse total shoulder replacement would be the only type of option for that patient. After having a discussion about which type of shoulder replacement would be better for the patient, we then proceed to surgery. This surgery can be done as an outpatient surgery where a patient spends some time in the hospital before being discharged home the same day, or it can be done as a 23-hour observation type surgery in which the patient stays overnight. In general, this surgery can take anywhere between 45 and 90 minutes depending on different anatomical factors, and the patient will wake up from surgery and immediately will begin to work with physical therapy in the hospital. The patient will get up and move and make sure they're able to take care of all activities of daily living and make sure that they are comfortable before being discharged. If the patient stays overnight, they will again work with therapy again in the morning before being discharged home. The patient will be discharged home and a therapist will be arranged to come to the house for about 4 weeks. Typically a patient is in a sling. If a reverse shoulder replacement is used, the patient will be in that sling for about 2 weeks. If an anatomic total shoulder replacement is performed, that sling will be used for closer to 6 weeks in order to protect the rotator cuff repair that happens during surgery. The therapist will begin to work on light range of motion, and again, this differs a little bit on the type of shoulder replacement that is performed, but for the most part, during the first 6 weeks, the patient can move their shoulder as long as everything is below eye level and that they can see their hand at all times. I will see the patient at 3 weeks post-op and make sure the incision is healed nicely. And at that time, we will typically arrange for outpatient physical therapy to begin as soon as the home health therapist stops coming to the house. Usually an additional 6 to 8 weeks of outpatient physical therapy is done after a shoulder replacement. In general, by 6 weeks, a patient will begin to aggressively work on all range of motion, and all range of motion is allowed as tolerated. The 12-week mark is when we begin to work on strengthening overhead. Typically, I consider a patient fully recovered from this surgery at around 4 to 5 months post-op, in which I would then allow all activities. Typically, I recommend no more than 50 pounds lifting overhead with a shoulder replacement type surgery.